Invitations can change your life. How you respond to an invitation can change the course of your life. Welcome to Heart Talk with me, Dr. Charles Lee. After 42 years as a medical doctor with 35 years of experience as a plastic surgeon, I have faced real-life issues in health with open heart bypass surgery, a financial crisis, and yet went on to earn ringgit 1 million within 5 years. Struggled through relationship and spirituality issues on my journey to live my best life. So if you are searching for real-life solutions to real-life issues, then join me at the Heart Talk podcast for insightful interviews, heart-to-heart conversations, and selected book reviews. And together, let's talk. Nine years ago, I did my first podcast with a clinical psychologist in Sydney, and the first words she said to me was, "Charles, be kind to yourself." I was struggling with psychological issues after my own open heart bypass surgery. Now, 9 years later, I'm still seeking the right solution on how to do just that. How to be kind to myself. And lo and behold, I recently happened to hear another clinical psychologist, Christine Runyan, on the On Being podcast. And I was fascinated at her explanation of the mind-body connection and how this has been disrupted. And we should now engage the current pandemic situation with resilience and mindfulness. I have titled this first of a two-part conversation as The Unexamined Life and the Power of Pause, which is so practically helpful as I apply it to my own life, and I hope you will too. Christine Runyan is a clinical psychologist and professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School. She is a certified mindfulness teacher. Christine co-founded and co-leads Tend Health, a clinical consulting practice focused on the mental well-being of healthcare practitioners. I'm Dr. Charles Lee. Let's talk with Christine Runyan. Can I call you Tina?
Please do, yes.
Okay, I know how busy you must be, and the world's just going faster than we can cope with, and so I'm pretty excited and all tuned up to get the best out of you with the time. And I've titled my conversation with you as The Unexamined Life. Because I never in my lifetime did I ever press pause button and stop and examine my life. And that's why I've ended up where I am today. So if I can take you into that kind of a mode of discussion of what Socrates said, the unexamined life is not worth living. And if all of us can just stop and examine our lives, and being a clinical psychologist using neuroscience, take us into that area where none of us have time to stop because our lives are louder than ourselves.
Yeah, your story reminds me of, I think if we pause to examine our lives, it is almost always, and certainly the stories that I hear, and I'm sure the stories that you have had the privilege to hear in some of these crucial conversations, it's almost always in the face of some unwanted, unwelcome, and oftentimes quite tragic event. So in your case, in needing bypass surgery, and
Sure.
In the case for a lot of the people I work with, and even for myself, I think the point at which I finally paused was really a point of pretty extreme depletion, sort of cognitive depletion, where my curiosity and emotional depletion, where my empathy and even physical depletion, where my energy all started to kind of fail me. And And so that is often what brings many of us to a screeching halt, to ask this question of examining one's life and priorities and values. And I think what you're sort of hinting at is, what would it be like if we didn't all have to come to that point to start
Right.
to ask those questions of ourselves? What if we could back that up and be quite intentional in our lives from a much earlier point that wasn't initiated through tragedy?
At what age should one be mentally, physically, emotionally aware to stop and start examining the life?
Well, I would love for it to be around adolescence, because I think we would prevent a lot of
Yeah.
a lot of impulsive actions. But truly, that part of our development, it's almost necessary to take risks, and our prefrontal cortex, our frontal lobe, isn't actually fully developed at that point. And
Okay.
so much of what we do during that period as humans in our adolescence is certainly around a lot of risk taking, a lot of trying things out and trying things on to be able to
Sure.
form our identity. So in some ways, that's probably too early. I will tell you that the so much of my work is done with physicians in training, and in a particular part of their training, in their residency or fellowship training. So they've completed medical school, which is a very heavily cognitive exercise, as you well know.
Sure.
And then they enter this period of residency training, which is quite, it's quite precious, thinking about that career trajectory compared to other professional careers that people may have, where they finish kind of college and then go into their first job. So this is their first job, but it really is the crucible, I think, of personal and professional identity development that takes it in a way that either inculcates ways of being with themselves, that sets the early groundwork for, I think, burnout and disengagement or even cynicism, or can lay down some bricks for an examined life and for a very value driven life, where the reason for becoming a physician really interdigitates with their own kind of humanity and how they are with in relationship to themselves. So that
Okay.
off, I think, age wise, that for most people, if they go straight through or take 1 or 2 years off, I mean, we're talking about really late 20s, early 30s.
This word mindfulness, is very loosely used. When they Google it, when they go into TED Talk, everybody's talking about the mind and the mindfulness and all that. Brain, I can understand because it's an organ, but
Hmm.
mind takes a mind to understand another one's mind. And where does it reside? How does one connect that with the body? Because everything that we hear today is about this distraction, dysfunction, disenablement, this. So, Tina, I'm going to take you to that point of anybody listening in. How do we connect the mind to the body? When does that start? And how do we, from a layman's point of view, somebody listening, non medical, because everything that's happening in our lives is a disconnect between the mind and the body. And because of that, intersection that is broken down and fractured, that we end up with so many problems that we face in our own lives.
Yeah, I mean,
Would-
that what's coming to mind for me in that question are two things. Empathy and compassion, I think, are really founded on this capacity to listen,
Right.
and to really listen to one another, not just with these, with our sense organs, our ears, but to really allow somebody's experience and sharing of that experience to penetrate beyond just trying to make sense of it in one's own mind, or worse, trying to solve some, identify and solve some problem. So listening comes to mind, and then presence.
Yes.
And presence has to start in the body.
Okay.
And so, because to really be able to listen to one another, to listen you also have to cultivate that capacity to listen to oneself. And I really think both of those require presence.
When you talk about presence, how does one savor the precious present? Because it's all about living in the present now, isn't it?
Mm,
And your thoughts as a clinical psychologist, how do we cope with what's happening around us, and at the same time have an inner vision of what's happening on the inside and cope with it in the present?
mhm.
Because I can hear you that presence and present is something very real, that we are living in it, and how I engage it myself is different from how you would engage it. So how does one live in the present and make it precious? No.
Mm.
The reason why I'm asking you this is because one of the first questions that when I sat next to Claudia and I told her what I'd gone through, she says, Charles, you need to be kind to yourself. Until now, I just don't know what it is. You know, if I have a glass of wine, am I being kind to myself?
Mhm.
If I have a chat.
Well,
So
and I work a lot in that space because of I work with clinicians and medical school in the path of medical training, and probably true in some other health professions as well, is actually a systematic process of detachment from oneself, to the point
also,
of yeah, well, to the point of um, not tuning in, not being present with one's own, truly one's own biological and bodily needs. I talk with a lot of people who very intentionally limit their intake of fluids so that because they won't have time to use the restroom or don't want to have that internal sensation, or will deny that, that hunger and sort of a biological need, a biological signal that your body, your brain needs some additional fuel, and detach from that and ignore that, or even needing to sit and to rest. So I do think that the training in that way builds a capacity to detach from oneself. That ultimately is the absence of presence. Because if we're detaching from self, but the expectation is to really be in presence with our patients and people that we're caring for, you're not flexing that muscle, you're not developing that skill. And so you either get people who have a level of unhealthy altruism in a way that completely ignores oneself in service to others. And I would argue that that may not be you may actually not be able to bring full compassion and presence in that way if it doesn't include oneself. um,
but you
so
have to start off with yourself first, right? I mean,
yeah,
you always talk about having compassion for oneself. How
yeah.
does one do that? I want to navigate in that area, because still today I still do not know how to do it. To be kind to oneself, to be compassionate to oneself, because that's all about inner life, isn't it? It's inner
It
healing.
is. It is. I love that you've said that, because oftentimes I think the idea of self-compassion gets conflated with um, the word self-care, or doing something nice for oneself, that I'm being self-compassionate because I'm I don't know, taking a mental health day and not going to work, or going to the spa for, manicures and pedicures. Like, that may be a compassionate thing to do for oneself. But it really is about this inner world. It's about our inner relationship to and with ourselves, through how we are in relationship to ourselves. It is sort of this, first core relationship that has to do with presence as well. It's how do we talk to ourselves? What kind of internal messaging are we giving to ourselves? That most of us have a pretty intricate inner world, and it's whether we sort of pause and take the opportunity to really reflect on that, and to really honor it. So
So
self-compassion, I think, very much is about, our relationship to ourselves first and foremost, and not just, not just when things are going poorly or we're upset, but also when things are going well, and that we can, if we can begin to unhook our equanimity to the external things around us, whether those be accomplishments or goals, or again, sort of unwelcome things that we don't want in our lives that maybe are stumbling blocks to to our goals or how
Yeah.
we thought it was going to be. So it's that uncoupling from what is happening to our own equanimity, which doesn't mean we have to be, that we have to be excited or happy about things that sort of thwart our progress in some way, or, illness or even loss of life for somebody that we care about. We don't have to, revel in that and be happy about it. But can we be unperturbed, in our inner experience, and have some acceptance around that, which is, is easy for little things and really
Really,
challenging,
really.
and a lot of work for big things.
Would you agree that the mind is centered to everything?
Such a good question. So more and more, I really experience my life personally, trying to experience it through my senses, through my sensory experience, which does in some ways include, the mind sometimes, like really as a sixth sense. The ears hear things, the eyes see things, the mind thinks things. So I do incorporate the mind into that. And just like, my eyes are not 20/20 vision, so I don't see things the way somebody with 20/20 vision would literally see things, or my hearing might be slightly off. I may not have as much sort of breadth to the tones that I can hear or how I hear them as somebody else. My mind is also subject to various kinds of interpretation and noise from my own personal history, from my mood in any moment is going to certainly color sort of how I see,
Sure.
a storm coming.
Yeah.
So so I think the mind is, in many ways, I guess I would say, I think the mind has been given, it has been given too much centrality, and our sensory life has really been relegated to the back seat, because as humans, this is sort of our unique aspect, for all of its wonder and good and ability to daydream and imagine, and all of its capacity also to create um, some, what I think are actually some really pernicious tools that threaten our connection and belonging with one another and oneself. Namely
Wonderfully
these
said. Well, yeah,
these
wonderfully said.
things
That's
that
right.
come in these little square
Yes.
devices,
Yeah,
or you
right.
see it in healthcare, really, this, attendance to the truth being embedded within the electronic medical record, not the truth that is sitting right across from you.
Hmm.
And yeah, so I think the mind actually has been given a little too much center stage, and I invite and try to bring that to my own experience. And obviously, I have a meditation practice that helps me to touch into that in a very formal way, and then try to actually bring that formality into day-to-day moments throughout my life. And it's really how I work with patients, even through this medium, is I use my own, sort of self as instrument, kind of very old school medicine, and really notice how somebody's experience through their words, through their affect, is touching me. And that I use really as a deep source of information to know how to bear witness and to hold space for that particular person, that is much less about what's
Sure.
going on up here.
Yeah. it's more of what's going on in here too, right?
Yeah.
That at the end of the day, the heart of the matter is the matter of the heart. Tell me, Tina, we grew up with the Beatles, and
Mm.
for me, they were the Fab Four. And when I had my open heart surgery, I remember the cardiologist that I interviewed on Heart Talk once said there's the Fab Four of coronary artery disease. And that is, lower is better, lower blood pressure, lower cholesterol, lower weight, lower, sugar and all that. So from your field of clinical psychology, tell me about the Fab Four of DOSA: dopamine, oxytocin, serotonin. These
Oh,
are
yeah,
these neurotransmitters get you into a state of mind that is good for the soul, right?
yeah, yeah. Right. I mean, I mean, this is sort of right, the tools that they have in psychiatry are to do this exogenously, right? You sort of like, you distill it down into some capsule powder form and you ingest it to affect these neurotransmitters. And I think from I care for a lot of people where at times I think medication has a role and has a really central, effect on people's well-being and mental health. And yet, our innate ability to cultivate some of these, does exist within us. It does take a little more intentional work and
Sure.
effort to begin to cultivate these, and to also know when sometimes it is less. Sometimes less skillful ways of coping that actually can bump our dopamine in particular,
All right.
which feels good, right? Which feels good and has a very naturally reinforcing property to it. I mean, that is essentially, how people become addicted, if you will, to certain, either chemicals or certain habits, habits of behavior or habits of mind, because underneath, you have this circuitry happening and this pretty steady release of a neurotransmitter that creates a positive, uplifting, spacious mood.
I'm sure. So you would use that as like simple strategies that one can use to develop those skills.
Right,
I remember
right.
you mentioning about curiosity and how do you stimulate that? Have a curious mind.
Yeah.
I
Yeah,
mean,
and we can be curious about, I mean, this is where you can be curious about one's own internal experience. So, pain is an example of that. We don't think of pain as something that generally elicits, any of these feel-good neurotransmitters. Um, However, when we can bring some curiosity to our experience, our direct experience of pain, that can shift the calculus so that with the curiosity, you do have a little bit of release of things that can lessen the pain. Literally, sort of, I mean, we have our own endogenous opioid system that can work in our favor, but just bringing that sense of curiosity rather than the contraction of, oh, this pain is terrible, I can't believe I'm in this pain again, how long will this last, what am I going to ever be able to do this thing, which is a very human reaction to discomfort. Just like how to learn how to be with your own internal narrative towards yourself, your own critical mind towards yourself, can invite also some of this neurochemistry that actually can create some ease for us.
how to recover in many people's life what has already been passed and
Yeah,
start valuing the precious present. How do we tap into one's inner life and
yeah.
make sense of it? I want to go
Well,
there. Were you happy to go there
yeah,
with me?
yeah. I mean, I talk with a lot of people, yeah, obviously as a psychologist who get really hung up on a question of why.
Yeah.
um,
Yeah.
and have some difficulty sort of setting that down because it's a very heady process.
Why
As
me?
though if I can understand all of the why, then I can dramatically change it from this point forward. And what I know about the power of patterns and the power of habits, and also our associative factors in our brain. You know that saying that neurons that fire together wire together.
Yeah.
There are all kinds of ways that associations get made in our brain for really good reason to help us make lighter work of our day-to-day experience and to be able to make sense of all that's coming into our sensory experience and to try to create these shortcuts. Medicine is a lot like that. You sort of learn these cognitive shortcuts for things that serve you almost all of the time, and then you just have to sort of have some space for, like, what am I missing, what am I not considering, so that you don't overuse that pattern recognition. But that's just sort of how we're wired as humans. I mean, that's kind of our hardware. This moment is already laying down what tomorrow will be our past, you know.
I love that. I really like that.
And
That's
so
powerful.
it's,
Say that
yeah.
again. What did you say? Living?
Well, that this present moment right now is what will be our past tomorrow. And so we can spend a lot of presence, a lot of moments of time trying to unpack and understand, you know, our past.
Nice.
And in doing so, this moment is just getting woven into the fabric of the past so that tomorrow we're kind of doing the same thing. And so it's really, I work a lot with people who have some really on this struggle of dropping that, which is not easy
But you
at
don't want,
all.
but you don't want to do the same thing tomorrow, right?
Exactly.
You know, you want to rewrite tomorrow. So there you go. Well, they are fantastic. I mean, that's this present moment is what will be our past tomorrow, and so we got to live it to its fullness. You know. And Tina, listen, man, I wish I could spend the whole year talking to
You're
you.
very kind.
I pressed on to discuss the components of an integrated life as opposed to a compartmentalized life, and how we are wired differently for fear and safety and connection and belonging. And this is what she had to say, that life is about the doing.
I guess I would also say there's such a human tendency to over-focus on the things we wish we were different and under-focus or undervalue the things that that are really precious to us and that are important. And that is a kind of a natural tendency of the human mind to orient towards that which is unpleasant or potentially problematic in our lives, because you know we're wired for, you know, sort of two things. We're wired for fear and safety, you know,
Yep,
to
yep.
stay alive, and we're wired for connection and belonging. And
And we
so
can rewire them.
yeah, I mean, that is, and that's what neuroscience is sort of showing us, our capacity to be able to rewire it. It is a heavy lift, you know. It's a this is not light work in terms of, I mean, I think wonderful for the field of psychology, but it doesn't come from a top-down process. It really has to be a lot of bottom up and a lot of experiential things, which is why, you know, the field of psychology, I think, in just using our thoughts and our kind of our mind falls short, because our lives are experienced as a full integration, right, of what we think and what we sense internally and what we feel. And And so really actually being able to integrate all of those. So the rewiring happens through the doing, right? You didn't learn how to do surgery by reading surgery books.
Right.
You learned how to do your craft through repetition and through doing of the thing. You had to do some of that cognitive piece, but if that's all you had, you wouldn't be a skilled surgeon.
True.
And the same is true, I think, in terms of psychological practice and sort of this bringing this intentional pause and examined life, and any shifts we make in our life really don't happen exclusively up here, right? They really need to be embodied. And I think for a long time, psychology has really missed that embodiment piece.
And when you say embodiment, you're talking about the heart part of it, right? Because
Yeah.
I think if the heart is not involved with the mind, there's no transformation. You need both. Christine Runyan is a clinical psychologist and professor in the Department of Family Medicine and Community Health at the University of Massachusetts Medical School. She is a certified mindfulness teacher. She co-founded and co-leads Tend Health, a clinical consulting practice focused on the mental well-being of healthcare practitioners. You can learn more about that at tend.health. Heart Talk brings to you real-life issues concerning health, well-being, and spiritual living. Do visit our Heart Talk website at www.hearttalk.com.my. Subscribe to our YouTube channel, Heart Talk with Dr. Charles Lee. And we would love to hear from you by writing to us at charleshearttalk@gmail.com. Let's talk soon.